I'm Rick Kaler. Thanks for joining me. A few months ago, I scoffed when my wife told me about a report from CNN that the average individual unsubsidized health insurance premium was going up over 60%. Well, after receiving my 2016 premium notice from Wellmark Blue Cross and Blue Shield, I'm not scoffing anymore. My monthly premium for family coverage went from $1,400 a month to $2,140, an increase of $740 a month, or 53% in the way of an increase. According to healthcare.gov, the average Wellmark increase in South Dakota is 43%. I immediately started looking for ways to decrease my premiums. This has become an annual ritual ever since Obamacare was pushed through Congress in 2010. Back then, my family health insurance policy, now it would be considered a premium plan, had a low deductible with a maximum out-of-pocket of $3,500 and cost me $660 a month. Now, despite the president's promise that if you like your plan, you can keep your plan, I can't even purchase that same plan today. If I could, I estimate it would cost over $3,500 a month. In order to keep health insurance affordable, each year I've reduced my coverage, increased my deductibles, and paid a higher premium than the year before. I set out to analyze my options for 2016. After spending about 6 hours crunching numbers and poring over online calculators, I admitted defeat. There's no simple way to analyze plans to determine whether, based on your personal health care expenditures, you are better served to go with a copay or a deductible plan, a bronze or a silver plan, or if a health savings account is preferable to a plan with coinsurance. All the online calculators I found were limited in scope and woefully generic. My health insurance agent, he didn't know of any better ones either. Adding to my angst, while Wellmark makes policyholders' year-to-date health care expenses available on its website, it doesn't provide any breakdown of costs. You must figure it out for yourself how many drug or doctor copays you had, the average cost of a copay visit, the average total cost of those visits, and any other information you need for any type of analysis as to which plan is best for you. To say the least, the task was daunting for me, a financial planner, a numbers guy. How are average consumers supposed to navigate this? The need for this information is so obvious. One wonders, what are the insurance companies hiding by not providing it? Ultimately, I selected a bronze plan with no copays and an out-of-pocket cap of $11,900 on in-network providers and $18,500 on out-of-network providers. Based on my family's average health care costs for the last 3 years, my out-of-pocket spending for premiums, covered drugs, and approved in-network medical providers will be $2,612 per month, or $31,344 in 2016. My out-of-pocket costs were $11,420 in 2010, 5 years ago. That's an increase of 273%, or 18.3% a year. Now, what's interesting is by comparison, during the same period of time, medical costs only increased 16%. And my costs increased 273%. Medical costs are only going up 2.7% a year, and my medical expenses have gone up 18.3% a year. The increase in premiums is clearly not about increasing health costs. The $1,660 extra per month that I could spend on consumer goods and services in 2010 is now going to insurance companies to subsidize the health care of others. This was a clear-cut example of a massive transfer of wealth. Based on my family's needs, if I earned $97,000 a year, I'd qualify for a subsidy of $912 a month. But since I earn over $98,000 a year, I pay the full premium. Clearly, the only people who find the Affordable Health Care Act affordable are those who receive a subsidy or have a pre-existing condition. For them, Obamacare was a godsend. For the rest of us, it turned out to be one of the most devious tax increases in modern history. Thanks for joining me.